Major funding for these broadcasts has been provided by grants from New York Community Bank, AmTrust Title Insurance Company, Perfect Building Maintenance, M&T Bank, Customers Bank, Marks Paneth LLP, Ariel Property Advisors, Sterling National Bank, Capital One Bank, Collins Building Services, Meridian Capital Group. Additional support has been provided by grants from AVR Realty Company, Amerant Bank, Bank of America Merrill Lynch, B6 Real Estate Advisors, Briarwood Organization, Chase Commercial Term Lending, Chase Commercial Mortgage, Citizens Bank, CPEX Real Estate Services, Douglaston Development Levine Builders, Flushing Bank, Friedman LLP, Handler Properties LLC, Handler Real Estate, Hodges Ward Elliott INC, Investors Bank, James D. Kuhn Real Estate Center at Syracuse University, Kilroy Architectural Windows, New York's Window Company, Matone Group, New Banks, Newmark Knight Frank, Optimum Window Manufacturing Corp., People's United Bank, Rockefeller Group, Rosewood Realty Services, SJP Properties, Stonehenge NYC, TD Bank, Terra CRG, the Merengoff Family Foundation, and these friends. Lakewood, New Jersey, Middlebury College, the volunteer ambulance, big effect, Weill Medical Center, family medicine, sports medicine, First Sports Medicine, Hospital for Joint Disease, PSP, stem cell. I have Dr. Brian Halpern here today. Thanks for being here.
Pleasure.
We have a picture of your mother's father. Tell me about him and when they came to America.
So my grandfather was an attorney in Jersey City. He and my grandmother on my mother's side both were born here. Their parents came from Ukraine area. And my grandfather was a basic do-everything kind of attorney in Jersey City. He'd go down to the Russian bathhouse, get his hot steam, smoked a cigar nonstop. You could never see him without it. He was a brusque guy, but he was a great guy. My grandmother, amazingly, back then actually worked in New York City as a secretary for a seed company.
Right. When you told me, I didn't know what a seed company was.
They sold seeds. You remember the old times when you used to get those bag of seeds?
Oh, the small bag that you'd plant little trees.
Correct. When we used to do that, yeah. She was a secretary for that company when women really weren't working.
So your mother grew up in Jersey City?
Yes.
Okay. Tell me about your father's side.
So my father's side, my father's dad was born outside of Odessa. He came over when he was a teenager by himself, ended up selling potatoes in a cart down on the Lower East Side. That didn't work out too well. So then he worked on trying to get people to work on sewing machines and tried to get that going. That was okay till he got sick. And he moved up to Monticello thinking the air was better in Monticello. And he tried to start a farm. That didn't work. And he tried to raise animals. That didn't work.
This is your grandfather?
Yeah. And so he said, well, you know, I did pretty well with the sewing machine stuff. I have the barn already. Let me hire locals and we'll sew all this stuff in the barn. And that took off. And then he moved to Perth Amboy and opened up a tie factory.
So he was in the tie business?
Yes.
So was your father born in Perth Amboy?
No, he was born in Monticello, and he made the move when my grandfather did.
Okay. So tell me about your dad who became a physician.
So my dad grew up in Perth Amboy, ended up going to Rutgers undergrad, and then went to Hahnemann Medical School, decided he wanted to go into OBGYN, and at that time it was hard to just start a residency, so he did a rotating internship at Walter Reed Hospital, Then he was in the Air Force for a few years. Ultimately went to Baltimore, University of Maryland, did his OBGYN training, and ended up in Lakewood.
How was it Lakewood? Any story of that happening?
Yeah, so he was trying to...
I mean, the Monticello I can understand. You know, both areas had these hotels at one time.
Right. So Lakewood had the Laurel and the Pines.
Right.
That was still there at that time. That was a big resort. It hadn't burned down yet. But he was looking for a community that he wanted to live in. He found a doctor, Michael Gold, who was practicing there. He said, I'd like to practice with you. And then they started this big practice.
Tell me about how, I think you told me it was a very interesting story how your mother met your father.
She grew up in Jersey City, and she was going to Douglas. My mother was supposed to go on a blind date with my dad's best friend, but he couldn't make it, and he asked my dad to fill in. And so the blind date ended up being my dad and my mom.
Your mother was a very interesting woman. Tell me about your mother's career.
So my mother was a force of nature. She was an incredible person, incredibly giving, but went through a lot of hardship. When she grew up in Jersey City, she was a great athlete. They wanted her to be on the Junior Olympic swimming team. At the age of 11, she ended up developing a spinal cord tumor, which they drained at that time, and so she was left with a little bit of disability, a little bit of leg weakness, so her Olympic career was finished. She was a smart lady. She ended up being the head captain of the fencing team at the Lincoln High School in Jersey City, and then went on to law school.
She went to Douglas first, as you said.
Yeah, Lincoln, and then Douglas, and then Rutgers Law School, where she was the only woman in her class and graduated #1 in her class. And McCarter and English offered her a job. That's the first female they'd ever taken. That was a big firm in Newark.
They were the leading firm in Newark, and for them to bring a female was interesting.
It was a big deal.
Right.
And she was totally grateful, learned a ton. And then a couple of years into that, she got pregnant with me. And my dad was graduating from medical school in Hahnemann. So she told McCarter and English, I have to leave, and they weren't happy with that. And then as they moved around and ended up back in Lakewood, my mother went back to work as an assistant prosecutor, which was the first female assistant prosecutor in Ocean County, New Jersey, where Lakewood is. Then she went on to become a Superior Court judge in Ocean County, first female to do that. And this is all over this time period. She's become more and more disabled because her tumor recurred. She had another operation. She became paraplegic. So she was in a scooter. She was in pain all the time. She had multiple medical issues, but she would just put them aside and continue to do her job and was continuing to be positive and continued to make an impact. But if you were in my mother's courtroom, you knew she was there.
Tell me about Dad's practice. You said he worked for this Dr. Gold or something?
Yeah, Michael Gold. And then Michael left, they split up, and my dad established a big practice of about 7 OBGYN docs. It was great. He became essentially the founder of the group. Then he really wanted to learn more, so he specialized in gynecological urology. At that time, that was a new specialty, learning about that piece, the urologic part from the women's side. Continued to practice. He was an unbelievable obstetrician. He could deliver babies upside down, forceps, all this stuff. Any issues, any problems, they would call my dad.
He was the trouble.
He was it. And that, of course, that meant he left the house at 4 in the morning, at 2 in the morning. So you rarely saw him because he was busy doing everything.
So let's talk about growing up in Lakewood.
Yeah, so when I grew up in Lakewood, it was a very interesting community. It was diverse, racially diverse, very safe, great childhood.
But you had no desire to be either a lawyer or a physician, right?
No, I was just trying to figure out how to be a kid.
Right.
And then went to public high school, went to Lakewood High School.
And you said to me you cut lawns and you cleaned windows.
That's what I did for my summer jobs, exactly. Make some money, and in the winter I shoveled snow, I shoveled driveways, and tried to make some extra.
So how do you decide on Middlebury?
I was in the top 10 of my class, but we had like 1,000 people a lot of people. Applied to all these schools, and lo and behold, rejected. I didn't get anywhere. So we went on the next round of looking at schools, and Skidmore offered me a position immediately, which was great. That's the first year they were going to take guys. First year they were going to be co-ed. So do I go to Skidmore and be the first class of males, or Fortunately, Middlebury accepted me off the waiting list. Do I go to Middlebury? And
So you had two good liberal arts schools.
yes.
So when you started Middlebury, what were you planning to do? Any
I had no
ideas?
idea.
So talk to me about the volunteer ambulance, because that's really made the change in your life.
So I'm going to Middlebury. I'm really enjoying my freshman and sophomore year, more so than probably I should. I should have been studying harder. And I decided to volunteer for the ambulance in Middlebury because I really didn't know what I wanted to do. I was a biology major in case I was interested in that because I was better at that. And we got one call on the ambulance one morning, and we drove to 6 a.m. at 5:30. We drove to a gas station, and there was someone who had a cardiac arrest, and I did CPR on this gentleman, and he did not live. It was the first time I'd really experienced death in that kind of fashion, and I was totally blown away. I was devastated. So I got back to the campus. I was really didn't know what to do, so I sat under this tree just trying to absorb what had happened. And it turned out being a beautiful sunrise, beautiful day. And I basically said, okay, God, obviously you made this a great day, and I can coexist in this environment, and now I'm going to be a doctor.
Then you get to medical school.
So I get to medical school. I ended up graduating from Cornell, which is great. And
Right, which now gives you New York City.
yeah, which I
Which
loved
was-
being
right.
in. And in medical school, once again, I kind of didn't know what I wanted to do in medicine. I loved medicine. I loved taking care of everybody. I did great in surgery. I had honors in surgery. They wanted me to be a surgeon, and I just didn't see myself as a surgeon. For whatever reason, I didn't think that's what I wanted to go. And I liked taking care of everybody and everything and using my brain as well, so I decided to go into family medicine. And I loved delivering babies. I loved taking care of kids. I loved taking care of geriatric. I loved taking care of everything. It was an everything thing. You take care of soup to nuts, the whole family. You understand the dynamics. You become part of that. And my second year, my second year residency, my director said, "Look, I need somebody to cover a football game near Annapolis, Maryland. Would you be interested?" I said, "Sure, I'll go down and cover a football game." So I'm at this football game on the sidelines as the doctor. And if you had a heart attack on that field, I could take care of you. Or you had a concussion, I could take care of you. But if you sprained your finger, I didn't even know what I was doing, let alone your knee or your back. But I really enjoyed being around the athletes. I enjoyed the dynamic. And when I got back, I decided I wanted to learn more about orthopedics. I don't like the surgical piece, but there's got to be a way you can do orthopedics and not operate. So I did some electives in my second and last year. I'm completing my residency. I'm thinking I really like orthopedics. I really don't like surgery. What can I do? And at that time I said, well, I'm going to look into applying for a sports medicine fellowship, be a sports medicine doc, but not operate. There were 10 fellowships at that time. This is in 1983 I applied. And so I wrote to all the fellowships in the country, and most of them did not respond because I was not an orthopedic surgeon. I had not done orthopedic surgical residency. And then the one that did respond, I got a phone call from Dr. Jack Houston.
Right, the world-renowned Dr.
World-renowned Jack Houston, the grandfather of sports medicine. And I didn't really know who he was. He calls me up, asks me why I applied, and what was I thinking. And he says, all right, let's fly down to it was in Columbus, Georgia. That's where the Houston Clinic is, Jack Houston Clinic.
Right, he was involved with
Auburn, Alabama,
right,
everybody. And Jimmy Andrews, who we know as well as a great sports surgeon, was also part of this group. So I flew down to Columbus, Georgia. I didn't have any money. Flew down, landed in Columbus, Georgia, and Dr. Stephen Hunter was the guy who was supposed to kind of vet me. So Stephen Hunter was great. He was part of the group. Went to his house, said we're going to go to the Big Eddie, which was the dinner club. Now I'm a Northeast Jersey boy in the Deep South now. Columbus, Georgia is the Deep South. It's where Fort Benning is. And so we go to the Big Eddie, and then I stay at Dr. Hunter's house. He was kind enough to let me stay there. And we get up in the morning, and I'm excited. I want to go see the office and see what we're going to do. And Dr. Hunter says, we're going to go hunting today with Dr. Houston. And so we go hunting. And I've never touched a gun in my life, so I kind of be careful. I just stand around. We go dove hunting. We get done, and I go back to Dr. Hunter's house. We have dinner. The next day, getting excited about going and see the office and talk about the possibilities. And we go fishing. And pretty much on the way back from fishing, we stop by the office. I get to look at it, say hello to everybody, and then they take me to the airport. And I get on the plane, and I come home, and I tell my wife, Karen, I said, that was very pleasant, but I'm not going there. No, they didn't even talk to me about what we would do or anything. And in retrospect, it was a great way to interview me because it was a fellowship that no one had ever done. There was no non-operative sports medicine fellowship in the country. They didn't know me from Adam. And a week later, Dr. Houston called up and said, you start in August.
So you were there for 1 year, right?
I was there for a year as a fellow. I loved it. I was doing everything I could possibly do. I was operating. I was working 24/7. I was flying all over the place to cover these games. They opened their arms to me. They taught me all the orthopedics. I helped them with the medicine. It was great. It was just fabulous.
So you come back to New
Well, I didn't come back. Dr. Houston said, we want you to stay. We want you to join the practice. So I said, of course. How could I not do that? This has been the best part of my life. I'm doing exactly what I want to do. So I joined the practice, was there for another year and a half. Then we had our first child, Danielle. And at that point, deciding, do we want to raise our kids in Columbus, in the Deep South, away from their family, or do we do something else? And at that point, Dr. Andrews was leaving the Houston Clinic, and he was going to Birmingham. So we came back to Jersey.
And you opened up where?
I went to Princeton. I joined Sports Medicine Princeton as their non-operating doc for a couple of years. Well, then I left that group, and I opened up many offices myself.
Right, you had 2 or 3.
One in Marlboro, one in Hightstown. I ended up working in Brielle and Brick with another orthopedic group. And then Russ Warren at Special Surgery, I saw at one of the meetings, and he said, why don't you come to HSS, Hospital for Special Surgery? I said, well, I just left all these other things. I was just establishing all this. I'm working in Jersey. I said, I was honored that I was asked, and I said, I'll try it out a half a day a week. So in 1991, I tried a half a day a week out in New York, working at Special Surgery, and the rest was my other practices. And over time, it was half a day became 2 days, and evolved into my only practice.
Right, and you became the chairman.
And then I was the first non-operating doc in the sports service. We recruited more, and then we established a service, a primary care sports medicine service, and I became the first chairman probably about 8 years ago, and then did that for about 6 years and resigned as the chairman 2 years ago to bring in new blood and great people.
Now, few people realize that, you're an Emmy Award winner. Let's talk about Vietnam, long time coming.
So that stems from 1995 when a ride called AXA World Ride, where Jim Benson, who was on the board of HSS, put together this program to bring disabled and able-bodied athletes together under this nonprofit called World Team Sports. And the acronym TEAM means The Exceptional Athlete Matters. And it's about bringing able-bodied and disabled athletes and people together as a team to show what we can do, sports, conquer, support each other. And that was a ride around the world. And that took about 9 months. That was 13,000 miles. And I was the doctor in charge of all those different stages. We finished that. That was great. I did 2 of the stages myself. It was fabulous to work as a team, to be able to really highlight what we can do even better as a group than we can individually. But I felt like we didn't leave any legacy. We just went through the countries. We demonstrated what we could do. We educated the locals and the governments that disability doesn't mean you're unable. And then World Team Sports had the idea to then in 1998 bicycle from Hanoi to Saigon, which is now Ho Chi Minh City, which is the Vietnam Challenge. And that was similarly about bringing able-bodied and disabled athletes together. In this point, Vietnam veterans were the disabled athletes, for a common good, to show the strength of that so you can conquer all these goals. So that in that group, we had 10 North Vietnamese disabled athletes, 20 American Vietnam disabled athletes, total of about 80 people, including support staff, vans, coaches, psychiatrists, you name it. And we did that 1,200 miles in 3 weeks from Hanoi to Saigon.
We are climbing this at the hottest part of the day. You should be getting your water bottle all the time and dousing yourself, drinking a lot of water all the way up.
Now, there's a picture of two soldiers, okay, one Vietnamese and one American, both amputees, correct?
Yes, they were both amputees. One was a left below the knee, one was a right below the knee, and probably about a week and a half into the ride, they realized that they were in the same battle on the same day and lost their legs, perhaps being shot by each other. They didn't know that.
Right. There's another interesting point in the movie in regard to the soldier who's blind.
Yeah, that was Jerry Statmeiler. So Jerry was blind. His face was rearranged by an AK-47 when he was over there. He had a lot of anger. He had a lot of issues he was trying to get through. He volunteered to come, which was incredible. And we did a lot of outreach. We did not just do the bicycle ride, which was intense enough. We did outreach at schools. I did medical outreach at hospitals. We established rehab units. But we went to this one school, and Jerry is talking about his experience, and one of the folks in the audience, she was probably about 18, said, "What's the one thing you remember, Jerry, about the war?" And Jerry starts to cry, as we all did every day. And he said, "What I remember most is running through the fields, a 12-year-old has a gun pointed at my head, and I have to shoot at him. And I can't forgive myself for that." And so she comes up, and she hugs him and says, "The war is over." And everybody just breaks apart.
Right. So it won a number of awards coupled with an Emmy, and you even won an Emmy as one of the producers.
Yes, as one of the co-producers.
So let's talk. Then you wrote a book a couple of years ago on the
Knee Crisis Handbook. I was taking care of a lot of patients with knee problems. I was giving exercises, trying to demonstrate how to do things. And one of my patients said, "Why don't you just write a book so we can just refer to it?" And I ended up doing that.
And then there's another book where most of the large number of the contributors are on men's health.
Yeah, a lot of men's health magazines.
Right.
Pieces.
On that.
Yes.
Let's talk about PRP.
So PRP is platelet-rich plasma. It's an intervention which we use now for arthritis, for tendonitis, for tendinopathy. It's been around probably for about 15 years. I've been doing it for 11 years now. And I got into it because we would inject, for tennis elbow, we would inject cortisone. And it didn't make to me a lot of sense why we were injecting cortisone, because there wasn't a lot of inflammation. It was more of a breakdown of the tissue, yet we were doing it. And I researched at that point and saw in Europe they were doing this PR, platelet-rich plasma piece. They'd done a lot of animal research, which was good. It was at a very good safety profile. So I said, well, this makes a lot of sense. Why don't I try to do this for the patients with tennis elbow? And at that point, it was fortuitous. I had about 5 patients who had had recalcitrant tennis elbow, a year of pain, couldn't play tennis, therapy didn't help, injections didn't help. And I said to them, I don't know if this is going to work. I don't think there's a lot of downside. The safety profile is good. If you're willing to do it, I'm willing to do it, and let's see how this works. And fortunately, 5 out of 5, complete recovery, back to tennis, no pain, and I got sold on the PRP. And that was for tendon. So we started doing a lot more of that, began doing research on that on our own and publishing it. Then a couple of years later, same concept was, if this works on tendon, why won't it work on cartilage? Or why wouldn't it work on arthritis? So we did a prospective study at HSS looking at PRP for knee osteoarthritis. And that was very successful. So now we're doing it for a lot of indications. It doesn't help everybody, but it's incredible. It's using your own platelets to reboot your own healing and preserve your function and then sometimes return anatomy. I mean, we don't have a lot of things in medicine that work across both sides of the equation. The platelets, number one, stop your inflammation, which is incredible enough, that's ongoing. And on this side, they stimulate growth factors and stem cells to try to make new structure, new cartilage or new tendon. Most people can't make new cartilage, but some do. And they make over 400 proteins that we know about, and we're continuing to study exactly what we're doing.
Tell me about family. How'd you meet your wife? We have a picture of your wedding.
So my wife, so the best things that ever happened in my life are my wife, my 3 kids, and the Vietnam Challenge.
Okay, so tell me about your wife.
So I met my wife at a party on the Jersey Shore. I'd had a little bit too much to drink. She stood out. She was beautiful. I sobered up quickly, had a conversation with her, liked her, and asked her if I could take her out to coffee. And she kind of thought that was a little weird, but she accepted and started dating, and we got married.
The 3 daughters, tell me their names and what they
So
do.
Danielle's the eldest. She's 33. Samantha, 31. And Allison, 27. Danielle is married, attorney in Morristown with a 21-month-old, Matthew, who's great. Samantha is also an attorney, very successful in Dallas, married, and she is now 33 weeks pregnant with the baby girl.
And last but not least.
And Allison just got engaged. She's a teacher in Philadelphia area, learning consultant, and we're excited for that.
So the lucky thing in a way was fortunately that you didn't go to Skidmore, but you went to Middlebury and you had the incident over there. Jack Houston, okay, sports medicine, because you've been a leader in sports medicine. And thanks for being here today.
Thank you.